Today I'm going to talk about diarrhea. Why on earth would I talk about diarrhea? A couple of reasons. There was a recent recent study done by the CDC, Minnesota Department of Health, and reported at Infectious Disease Week regarding C. difficile. Most of you have heard about C. difficile. It's been growing in severity and awareness over the past few years. Now, why would I be talking about that? A couple of reasons. Number one, I work with dentists, and the specific issue on this piece of research was the role of dental providers in C. difficile. It appears that a good bit of antibiotic use may be coming from the dental community, something that we haven't noticed. There have been campaigns to manage antibiotic use with the medical community, but not quite so much with the dental community. Again, I work with a lot of dentists. The dentists I work with are very much aware of this issue, very focused on use of antibiotics, that sort of thing. In contrast to your average dentist who we tend to say is drill, fill, and bill. I mean, they're focused on doing those procedures. 500,000 people, according to the CDC, 500,000 people get C. diff every year, and 29,000 die from it. After you get C. diff, you've got a 20% chance of it coming back. If you're age 65 or older, 1 in 11 will die within a month of getting a diagnosis of C. diff. So again, it's a very significant issue in terms of causing death and disability in Americans, especially in the older population. That's obviously an electron micrograph of C. diff. But before we talk about this recent research, just a brief introduction. My name is Ford Brewer, F-O-R-D, B as in boy, R-E-W-E-R. Heart attack, stroke, disability, dementia prevention. PrevMed is the group I run. And again, we're going to talk about C. diff and dental antibiotics. So there's a meeting of infectious disease people. It's called IDWEEK. ID standing for infectious disease. In 2017 in San Diego, there was a presentation by the Centers for Disease Control and the Minnesota Department of Health. They looked at all of the cases of C. diff reported to the Minnesota Department of Health from 2009 to 2015. There were 2,176 reported cases. C. diff, by the way, is a reportable disease, so if it's discovered, a hospital or a healthcare provider is required by law to report it. That's in all states. Now, so out of the 2,176 that they found, they went back and did chart reviews and interviews on folks. Of the 2,176, they confirmed 75% of them, 1,626. And again, that's when they started going back to look at these specific cases. Of the 926, 57 had, of the 926 that they were able to confirm and find for interviews, 57% had had an antibiotic. 136 of those had had an antibiotic for dental procedures over the past month or two. Of these dental cases, they were older, average of 57 years old versus 45. And they were more likely to have had clindamycin. Clindamycin is an old standard antibiotic used a lot for antibiotic indications for dental care. This is an antibiotic that's associated with C. diff. the medical community has been warned off of using it, and I think that, well, part of the editorial around this information was that the dental community may not have been warned that well for this. This is one of the two reports that I got on this this case and this research. I'll put those links in the write-up. Again, this is from the actual web site for IDWEEK, and this was presentation number 78. And again, it gets into a lot of the details, most of which I've covered already. So, a couple of things to think about. Now, as you noticed on those numbers, we're talking about 15%. Where are most of the others coming from? Well, yes, I don't think dentists are the major source of antibiotics causing C. diff. I think we already know a couple of the major issues. Hospitalization and procedures with use of antibiotics, central lines, a couple of other things like that. On an outpatient basis, one of the things that you can do as a patient is not push on that doc in terms of getting an antibiotic for a cough, cold. That is the most common source of antibiotics on an outpatient basis. This is from the CDC site. Here's some advice for patients. Take antibiotics only as prescribed by docs. Be sure to finish the antibiotic. Tell your doctor if you develop diarrhea within a month of taking antibiotics. Wash your hands before and after eating, and anytime you go to the bathroom. Use a separate bathroom, and if anyone in the family has diarrhea, they should use a separate bathroom until they no longer have diarrhea. They didn't mention it, but there's a lot of evidence to indicate that regular use of probiotics is helpful. Again, risk factors for this are prolonged use of antibiotics and elderly. These are the two big risk factors, and again, prolonged use of antibiotics is going to be seen with chronic diseases as well as instrumentation within the hospital. Here are the symptoms: watery diarrhea, at least 3 bowel movements per day, fever, loss of appetite, nausea, abdominal pain, and cramping. This is transmitted on surface. It's called what they call fecal oral. When people clean themselves after going to the bathroom, they don't wash their hands effectively. It gets on surfaces around the bathroom, other surfaces. Healthcare providers can transmit it when they have a case and they're taking care of that case, and they go to the next case to provide care without washing it appropriately. Obviously, some more electron micrographs of the bug itself. One of the big developments in treatment of excuse me, C. diff over the past few years has been, believe it or not, fecal transplants. That's what it sounds like. It's one of the most effective treatments at this point. Antibiotics are the first-line treatment. I won't go into detail on treatment. I will say this is something that, again, death and disease with C. diff is often seen in people 65 and older. It's very much associated with antibiotics, very much associated with going to the hospital for reasons that we've discussed already. We talked about the importance of washing your hands, making sure that someone with diarrhea uses a separate bathroom. This diagram is talking about transferring from one hospital to another without proper notification that this patient has C. diff. So again, diarrhea on a heart attack, stroke, disability, dementia, death prevention channel. Thank you for your attention.